So the topic of my presentation today is the keto diet. And my audience is for adults who have very little nutritional knowledge and they're wondering if the keto diet is right for them as a method for weight loss. So it's important to keep in mind that there's limited research on keto and if it is actually safe for individuals to go on for the purpose of weight loss. So the point of my presentation today is to just list out some possible benefits and some possible risks of going on the keto diet so people are able to make a little bit more of an informed decision about it before they decide to go on it. All right, so what is keto? Keto is a high-fat, moderate protein, and low-carb diet. So I kind of broke down these numbers right here for you. So about 75% of calories are going to be coming from fat, 20% of calories from protein, and then only 5% of calories from carbs. Now, carbs are usually the body's preferred source of energy. And when we start depriving our body of those carbs, it kind of freaks out a little bit and goes straight into a starvation state. And when our body goes into that starvation state, it starts breaking down fat since there are no carbs there to break down. And when fat is broken down, it turns into something called ketones. And ketones are actually what is being utilized as the energy source now. So the whole purpose of keto is to be constantly breaking down fat and creating those ketones. And that is why people are using it as a method for weight loss. All right, so I'm going to switch gears here for a second and talk about the dietary guidelines for Americans. So this is nutrition information given to us by nutrition professionals. And they base it all on research and evidence to give us the most accurate and updated information so that we can make the best healthy choices in our everyday lives. So they really promote eating well-balanced meals that offer a variety of foods from each of the food groups. They also recommend that we follow a healthy eating pattern that includes the following the list of foods. So this list includes a variety of vegetables of all colors and even starchy vegetables. And then they really recommend fruits, especially whole fruits, grains, half of which should be whole grains, fat-free or low-fat dairy products, and then a variety of protein. And this can include lean meats, poultry, seafood, beans and peas, eggs, and then nuts and seeds as well. And then that last one is oils from plants. So they also break down how much we should be getting of each of the macronutrients. And the macronutrients are fat, protein, and carbs. And that's listed right here. So fat should be 20 to 35% of calories, protein 10 to 35% of calories, and then carbs 45 to 65% of calories. Okay, so I kind of broke down keto and the dietary guidelines just a little bit. Some of their differences include that the keto diet is increasing the recommended intake of fat by 40 to 55% while decreasing the recommended carb intake by 40 to 60%. These are really high numbers. And then protein may still fall within the acceptable range. It depends on who you are. Some people need more protein or less protein. And rather than promoting a well-balanced meal that is including a variety of foods from all of the different food groups, it is really restricting some of these food groups rather harshly. Okay, so we're going to look at an example of a 2,000 calorie diet. And when on a 2,000 calorie diet, keto would only allow for 100 of those calories to be coming from carbs. And this converts to about 25 grams. You may not be familiar with what 25 grams is when it comes to food. So this is the point of this list. Obviously, these are not all of the foods that have carbs in them. There's a ton of other foods out there. This is a very limited few examples. So if you look at this, if you were to eat one small apple, banana, or orange, that would have about 15 grams of carbs in it. And some of these have really small portion sizes. For example, cooked rice is 15 grams, but only in a third cup portion size, which is a very small amount. Okay, so when we start limiting our carbs like that, you don't have a lot of options throughout the day. So you have to be very careful which carb foods you decide to eat. So, for example, if you were to choose to eat toast and then milk, that's pretty much going to take up your whole carb allowance, and then you're not going to have any room left for some fruits and vegetables. Now, the benefits in fruits and vegetables include that it may help reduce the risk of heart disease and even protect against some cancers. And fruits and vegetables are full of tons of essential nutrients that are super beneficial for us. Some of these include folate, fiber, potassium, and then vitamin C, A, and K. Okay, so I want to talk about fiber for just a minute because it is actually a type of carbohydrate. So it has tons of health benefits, including that it aids in digestion. So it's really going to help prevent constipation and promote regular bowel movements. It may help control weight, and how it does this is it adds bulk to your meals. So it helps you to feel full faster and longer, and actually will likely cause you to eat less food if you already have that feeling of being full. It may also reduce the risk of both heart disease and the risk of diabetes. Okay, so while you are on the keto diet, you are not able to get as many of these essential nutrients, at least not the full recommended daily intake. So supplements are super awesome with helping with this, but the point of supplements is not to be the only source of nutrients, but to help get sources of nutrients. So most nutrients are better when they are consumed in your diet, and there are supplements of all the nutrients that we talked about, but it's recommended that you go and talk to your doctor before taking any supplements just to make sure that it's the right decision for you, because there is a possibility that with some there could be a toxic level involved if you take too much, and that can have some adverse effects on your health. And there are even some that can interfere with certain medications. So please go talk to your doctor before you decide to take supplements, but know that supplements are out there to help you if you do need them. Okay, so while you're on the keto diet, a large amount of your food is going to be coming from fat. And if you remember, that's about 75%. This does not mean that tons of saturated fat should start to be consumed, because saturated fat is more of an unhealthy fat, while unsaturated fat is considered the more healthy fat. So you shouldn't just be going and eating bacon and butter and coconut oil and all these things that are full of saturated fat. So a couple more examples are high-fat dairy products, fatty beef, and pork. And these are things that should be limited in the diet. And we should focus more on consuming unsaturated fats, which includes fatty fish, eggs, flax seeds, chia seeds, hemp seeds, oils, nuts, and avocado. Obviously, this is not a full list of all of these fats, but just a few examples. And then a quick tip, if you're unsure if something contains saturated fat, know that fats that are solid at room temperature are typically full of saturated fat, while fats that are liquid at room temperature have more unsaturated fat and therefore are healthier. So for example, we all know that butter is solid at room temperature, while canola oil is liquid at room temperature. So without even looking at that list, we know which one of those is healthier for us. Okay, so the big question that everybody wants to know the answer to, does keto actually work? And yes, there is some research that suggests that it does induce rapid weight loss. It is possible to even lose up to 10 pounds in a 2-week period within starting that diet. And it is suggested that the keto diet is only followed for 6 to 12 months and no longer than that. And this is to help avoid some of those longer term adverse effects that keto could have on your body, which we will talk about some of the negative effects later on. Oops. All right, so there may be people out there with diabetes who are overweight and looking for a way to lose weight. And some of them turn to the keto diet. So some research suggests that keto can help people with diabetes both lose weight and actually control their blood sugar. So how it helps control blood sugar is by carbs. When we consume carbs, it increases our blood sugar. So on the keto diet, since we are decreasing carbs, there's nothing really there to kind of increase that blood sugar. So keto may not be the right choice for everyone. Just because there is research out there that suggests it might help, you should still go and talk to your doctor if you have diabetes and are considering keto. There's also a possible risk of something called diabetic ketoacidosis, or DKA. And it is super dangerous and a really serious condition if someone were to get it. All right, so I just want to talk about DKA for just a second. So this occurs when there's a large buildup of ketones in the blood. So if you recall, we talked about how when we deprive our body of carbs, it starts to break down fat and that produces ketones. So when they go on this keto diet, ketones are going to start building up. And it can become super dangerous because it makes the blood more acidic than normal. And essentially, it starts poisoning your body. And it actually might lead to a diabetic coma, which basically just means you pass out for a really long time, and that can lead to death. So it's super important that you know the warning signs of DKA so that you can prevent it early on and go to the doctor if you start noticing these symptoms. It is a condition that slowly develops over time, usually. So there are both early symptoms and symptoms that happen later on. So some of the early symptoms are you feel thirsty or have a very dry mouth. You have high blood sugar. You have high levels of ketones present in your urine, and you are frequently urinating. Some of the later symptoms include constantly feeling fatigued, having nausea, vomiting, or abdominal pain. And then when vomiting is a symptom, the condition actually may develop much faster. It's important to note that vomiting may occur from many illnesses, so if it's happening alone, it likely is not because of DKA, but if it's happening while other symptoms are also occurring, then it may be a cause for concern. If you are worried, just go ahead and call your doctor and just kind of clear that up. You may also have difficulty breathing, and then you might have kind of like a fruity odor in your breath, which sounds kind of weird, and then difficulty paying attention. Your brain is going to start to feel really hazy and confused, and the reason for this is it's not receiving sugar, and your brain functions better when it is getting sugar to the brain. All right, so if you do still choose to go on the keto diet while having diabetes, it's super important that you are regularly taking urine tests in order to check the ketone levels in your urine. They actually have super simple test strips for this. They're not difficult at all. If you need more information, or if you're wondering if your ketone levels are too high after taking the test, always feel free, call your doctor, they can help you. All right, so sustainability. The definition of sustainable is something that is able to be maintained. So go ahead and ask yourself, how long do I think I can maintain a diet of very low carb intake? Some people have more self-control than others, and they might be able to go on a diet as restrictive as this for a longer period of time. But you might get bored with it. Some people really love bread and pasta and rice, and it's gonna be kind of sad if you don't get to eat your favorite foods. So for this reason, keto is typically not a sustainable diet. People are gonna have a hard time staying on it, and then as soon as they start kind of shifting back to their regular eating patterns, they're gonna kind of start to gain that weight back. And that shift might not happen all of a sudden, that it's like one day you're on keto and the next you're back to eating normal, but it might happen gradually until you return to that normal state of eating. So just keep that in mind. Okay, so following a restrictive diet like keto actually has the potential to create a negative view towards eating in general, and this can lead to disordered eating. So if you start to feel like you are feeling negative towards food, that could definitely be a cause for concern. So always use caution no matter what diet you choose to go on. So some possible symptoms of an eating disorder include dieting, losing weight, and controlling food have become a main concern. If you are frequently dieting, or if you have extreme concern about your body size or your weight and shape, if you're constantly thinking about weight, dieting, carbs, food and calories, or excluding whole food groups or types of food from the diet. Now, this is not a complete list of all the possible symptoms of having a disorder. This is just a few examples. And just because one of these might be occurring in your life, that does not mean that you will get an eating disorder. But if you do start to notice some of these things, then it may be a cause for concern, and it is better to go and get professional help right away rather than actually getting an eating disorder and having that be something that controls your life. Nobody wants to be controlled by food. All right, so keto has some possible short-term and possible long-term effects. So these short-term effects, typically together they are referred to as the keto flu. And they are temporary, but they're definitely not fun, not something that you are gonna want to have going on. So some of these include nausea, vomiting, dizziness, fatigue, insomnia, headache, constipation, and loss of energy. So just to talk about a couple of these, fatigue and loss of energy, this is going to be due to you not having those carbs, which is your body's preferred source of energy. It is not used to being so deprived, and so it's not going to be giving you lots of energy if you're not getting that. And then also loss of energy, just to note, that's kind of focused more on like exercising rather than like feeling tired, if that makes sense. And then constipation is going to be due to that decreased fiber intake. We talked about how fiber helps promote regular bowel movements and will prevent constipation. All right, and then some possible long-term side effects includes fatty liver disease, which actually could lead to liver failure, which we super don't want that to be a thing, right? And the possible reason for this is because we're increasing fat intake, and so your liver is just going to struggle. It might struggle with dealing with all that extra fat coming into the body. And then another possible long-term side effect is kidney stones, and then vitamin and mineral deficiencies. And this is going to be due to decreased intakes of both vegetables and fruits. We talked about how they all have tons of essential nutrients and how they're super important, and that there are supplements out there that can help you, but remember that it's better to get these vitamins and minerals from dietary sources rather from supplemental sources. And that's it.